Epilepsy is a brain condition when there is abnormal brain electrical activities, which sometimes results in body parts movements or jerks. Some people call them seizures, some people call them fits. There are many conditions can cause seizures, including something abnormal in the brain, for example, tumor, stroke. But some people's seizures is because of tiredness, not enough sleeps, or not enough sugar or salt in the blood. Whereas some people are genetically predisposed to develop seizures and they have family histories, and seizures occur among some of the members in their family. However, this is not common. There are many different types, but in general, we divide them into focal and generalized. Focal means the seizure occur in one side of the brain, for example, left side or right. Generalized means they occur both sides at the same time. So focal seizures sometimes presented with jerks only involving one side. For example, jerkiness of the hands in the right side and of the leg in the right side. Some people has focal seizure where they have abnormal behavior, where they stop talking for a while, they stare, or sometimes they have smacking of the mouth and lips. And some of them has very odd sensations before the seizures, like feeling fear, or feeling deja vu, or having some abnormal gastric sensation. We call this aura. Whereas for generalized seizures, it occurs both sides at the same time. So people will fall, they have jerks of the limbs, their eyes will go up, sometimes they may bite their tongue, or they may wet their trousers. We call this generalized seizure. But some of the generalized seizures are milder, where children with only blanks staring, and the teacher may thought that they are having poor attentions. Or some people only have jerks in the morning, whereas in other times they are fine. These are called myoclonic jerks, whereas the blank staring is called absence seizures. To find out where the seizure is coming from, whether it's left or right or both sides, EEG is very important. EEG in our term is called brainwave test, which we put wire on the scalp of the head to record brain electrical activities, and from there we may able to identify abnormal electrical activities, and we will be able to tell us where the seizure is likely coming from. Other tests, for example, blood test, brain scan, is mainly used to look for the underlying cause which can cause seizure. Someone having a seizure in front of you, these are the things that you can do. First thing is you can lie the patient down on the floor, make sure nothing is blocking him and his nothing is going to cause injury, like for example chairs or tables. Don't try not to put anything into the mouth because it may injure him further. Preventing the tongue biting is not going to help. In fact, tongue biting is usually harmless. It's not going to cause death. So after the seizure, you may lie him on the side so that the saliva may come out. After a while, you may call him and wake him up. And as long as he has woken from the seizure, then the conditions of the seizure has stopped and he should be fine. Usually seizure lasts less than 5 minutes and is usually not life-threatening. So far, out of 10 patients who need medications, usually almost 6 to 7, their seizure will be able to control with medication alone.
%80 of epilepsy patients can be cured or at least controlled with appropriate medication. About 20% of these patients, that means 20 out of 100 patients, will end up with incurable epilepsy, or what we call intractable epilepsy. These patients need further assessment, and out of the 20, probably about half of them will qualify for epilepsy surgery. Epilepsy surgery is only offered to patients who have got what we call structural lesions within the brain. The MRI will show us a lesion, and the EEG will localize the lesion as the cause of the epilepsy, the cause of the abnormal electrical activity. So epilepsy surgery in essence takes out this abnormal area, thereby completely eliminating any abnormal electrical activity, and it provides a long-term solution to the problem as compared to medication which has to be taken continuously. We have to always compare the risk and benefit of every surgery. A patient who has got intractable or continuous epilepsy which is not controlled by medication will end up with a significant cognitive and memory as well as behavioral problems in the long term. As opposed to that, surgery prevents this long-term epilepsy and thereby reduces all these long-term complications. In which case, surgery is actually potentially brings about more benefits than the risks.
So for a patient to be considered to be eligible for surgery, there are a few important steps that need to be taken. First of all, the patient has to have a focal seizure and they have failed 2 or more medications at maximum dose tried by their neurologist. All patients will need some sort of brain imaging. MRI will be the most preferable neuroimaging to look for any possible lesion that can be resected. Following that, we will arrange for the patient to be admitted to the hospital under our neurology ward, and we will have a 3-day video EEG monitoring in the hospital. And this is to learn about the type of the seizure that the patient has and which part of the brain that is affected. On top of that, we may consider additional brain imaging such as a SPECT scan or PET scan, and this will be discussed further with you by your neurologist. After we have done all these important steps, then we will then have a discussion in a multidisciplinary meeting in which there will be not just your neurologist, but there will be the, experts in brain imaging, the surgeon. We will all be sitting down, discuss about your case, and also decide on which will be the best treatment option for you.
VM adalah satu ujian ataupun satu singkatan daripada video EEG monitoring, di mana ujian VEM ini dijalankan ke atas pesakit sawan untuk melihat keadaan aktiviti gelombang otak pesakit. Dalam masa sama kita nak tengok juga bagaimana bentuk sawan pesakit itu. So untuk ujian VEM ini adalah kesinambungan daripada ujian rutin EEG yang telah pesakit jalani sebelum ini. Ujian video EEG monitoring ini akan dijalankan selama 3 hari. Pesakit akan dipasangkan elektrod ke atas kepala pesakit seperti mana ujian EEG biasa bagi melihat aktiviti gelombang otak pesakit. Jadi pada sepanjang 3 hari ujian video ini dijalankan, pihak kaki tangan makmal neurologi akan sentiasa mengawasi pesakit dan kiranya pesakit mendapat sawan, kita akan melihat di mana permulaan aktiviti otak yang berpunca sawan itu berlaku. Pada hari terakhir ujian video EEG ini dijalankan, pesakit akan menjalani satu imbasan otak yang dipanggil SPECT scan. Jadi bagaimana SPECT scan ini dijalankan? Pada hari terakhir itu, pesakit akan disuntik dengan sejenis cecair tracer oleh kaki tangan daripada bahagian perubatan nuklear. Jadi tracer itu digunakan adalah untuk melihat di mana kawasan otak yang paling aktif semasa pesakit mendapat sawan. Jadi kiranya pesakit mendapat sawan, dengan segera kaki tangan bahagian perubatan nuklear ini akan menyuntik tracer ini kepada pesakit. Walau bagaimanapun kiranya pesakit tidak mendapat sawan, tracer ini tetap akan diberi bagi melihat di mana kawasan aktif otak. Imbasan otak ini akan dijalankan selama lebih kurang 1 jam.
Epilepsy has to be controlled in these patients so that they can move on to normal life. I hope these patients will try their best to find a solution. In this case, if it is medication, then you try your optimal medication. However, if medication fails and surgery is an option, we should always try to do the best, which includes surgery. In this case, we have the facilities, we have the doctors, we have the professionals, we have the support service. And so the patients should not be afraid of thinking about surgery as a viable and good option for them to approach.